There is breaking news tonight in the nationwide vaping crisis, another death and new reports of possible lung disease. Janet Shamlian joins us with these new details. Janet, good evening.
Nora, good evening. That's right. The death toll linked to vaping is climbing tonight. Health officials in Kansas today reporting one new death directly tied to vaping. That brings to 6 the total number of deaths across the United States. And here in Houston today, officials announced 3 new cases. Here, all of the people who are suffering are under the age of 21. Tonight, the Centers for Disease Control reports that it's investigating 450 possible vaping-related illnesses across 33 states. 2 more cases were confirmed today in Idaho. Symptoms include severe stomach problems and shortness of breath, and some patients have been put on ventilators. No one has been able to identify a single product or ingredient in e-cigarettes behind these illnesses, but patients have reported vaping both nicotine and THC, which is the active ingredient in marijuana. And Nora, tonight the American Medical Association is joining other health officials by asking people who use e-cigarettes to consider stopping using them as this investigation continues.
There is growing alarm this evening of the crisis involving e-cigarettes. A 6th death tied to vaping was reported today, with 480 confirmed or suspected cases of vaping-related illnesses in 38 states and the Virgin Islands. Ann Thompson now with the latest on this epidemic.
New urgency tonight in the nation's vaping emergency. The 6th death linked to vaping is a Kansas woman who officials say died a week after using e-cigarettes for the first time. Over 50 and with underlying health problems, her lungs filled with fluid. And today, the American Lung Association saying bluntly, do not use e-cigarettes, warning they are not safe and can cause irreversible lung damage and disease. 21-year-old Elijah McClure went from feeling sick to dependent on a feeding tube and respirator in a matter of days.
I heard my son's voice in well over a week.
Cedric and Tammy McClure say their son, a former Minnesota high school athlete, started vaping at 15.
This is what I found.
As more states investigate vaping-related lung injuries, officials in Houston today confirmed 3 cases, all teenagers.
It is not an infection. It does not respond to antibiotics, and it is very severe.
A new American Heart Association study finds flavors drive vaping usage among 18 to 24-year-olds, especially for those who never smoked traditional cigarettes.
You know, these companies have done real harm to a generation of children, and they did that knowing that nicotine was an addictive drug. You know, it's appalling.
The vaping industry is pushing back, insisting this is a crisis linked not to their products, but to illegal THC oils, the active ingredient in marijuana.
So, Ann, the FDA has regulatory authority here. What's preventing them from acting?
Well, I spoke to an FDA official today, Lester, and he told me that the investigation into these illnesses is a top priority. But as of tonight, the FDA has not zeroed in on the specific product or substance causing all these injuries and deaths. The agency says it just needs more information before it can take the action so many are calling for. And you can expect that when a congressional panel takes this on at the end of the month, they're going to ask these questions of the FDA. Why haven't you done more?
It keeps getting worse. All right, Ann Thompson, thank you.
We're going to turn now to the alarming news on vaping tonight. Right here in the Houston area, a high school student collapsing after vaping and was rushed to the hospital. And now a 6th person has died linked to e-cigarettes. That patient in their 50s. Here's ABC's Adrian Bankert now.
Tonight, new alarm about the risk of vaping after an emergency at this Houston area high school. Officials say a student was suddenly sickened after vaping.
A girl had handed to him. He hit it, he passed out, and he would not wake up. So the ambulance had to come get him out in a stretcher.
It's just the latest in a growing number of cases around the country. Doctors are reporting serious lung illnesses. More than 450 patients and counting. And tonight, a 6th death linked to vaping. That person in Kansas, over 50 years old with underlying health problems whose symptoms worsened rapidly. Most of the cases are linked to vaping THC products, but doctors are scrambling for answers.
We don't know, but something clearly has changed in the last month to 6 weeks in the products that are being vaped, and that's what the CDC is working to find out.
18-year-old Seema Herman vaped nicotine, then THC over 2 years, getting sicker and sicker, ending up on life support on a ventilator.
It was terrifying. It's just getting weaker and weaker by the minute.
Doctors put Seema in a medically induced coma. When she woke up, she asked to write this message on Instagram, now seen around the world.
I'm just trying to share my story and save people's lives.
And Adrian, tonight the American Lung Association is also just out with a new warning.
Yes, David, that's right. They're saying that e-cigarettes are not safe and can cause irreversible lung damage. They're saying young people are particularly at risk because their lungs are still developing. The Surgeon General is calling this a youth e-cigarette epidemic.
A strong warning: if you use a vape pen, put it down. They are growing in popularity among teenagers, and now there are growing health concerns.
Yeah, we've been hearing about this. 3 teens in Houston have been hospitalized recently from vaping-related illnesses. Look at the map. So far, more than 450 people in 33 states have gotten sick. This is according to the Centers for Disease Control and Prevention. And 6 people have died from those illnesses.
Our team is taking a closer look at the issue. We start with Chris Costa outside the health department. Chris, is there something in the vape products that is causing this?
Well, Len and Mia, that's exactly the question that health officials here in Houston and the CDC are trying to answer, but they don't have that answer right now. We spoke to one vape shop owner who says he believes there's likely something else that's linking these products to lung damage.
It seems like every morning now there's something on the news related to vaping illness.
Eric Jones says he started vaping 7 years ago to quit smoking cigarettes.
Jolly Ranchers, strawberry lemonades.
Now he owns a vape shop in Houston and believes the nationwide outbreak of lung illnesses are caused by something other than vape liquid containing nicotine.
There's got to be a different component that's causing these issues other than the products that have been out for over 10 plus years now.
So something has changed, and that's what we're trying to figure out.
The Houston Health Department announced Tuesday it's investigating 3 cases of teens suffering lung damage from vaping, saying these are not infections and cannot be treated with antibiotics.
There does not seem to be any antidote, any magic bullet to reverse this.
The health department, the CDC, and other federal health agencies are looking to see if those people who were hospitalized were vaping any other products besides nicotine, like THC.
We don't have the answer to that question. That's one of the things that's so frustrating about this. The bottom line is this is a real phenomenon.
Shop owners like Eric say there needs to be more oversight in the industry to prevent more young people from getting sick.
Until there can be a conclusive study to give you exactly what's causing these issues, we really don't know what can be done. Because if it's a THC component or some other illegal substance, then that shouldn't be happening anyway.
Health officials say they're particularly worried about this rise in lung damage because they say it's predominantly affecting young people. Now they say they're going to go back and look at previous cases to see if any of these symptoms match the CDC's definition for this vaping-related lung illness that's affecting people nationwide. As for those 3 teenagers in the Houston area, the health department confirmed to us late this afternoon that 2 of them have already been discharged from the hospital. They're expecting all of them to make full recoveries. Len and Mia.
All right, some promising news. There's still a warning to others. Chris Costa reporting.
Right now, there is a big warning for the dangers of vaping as Houston health officials investigate 3 possible cases of lung illnesses linked to e-cigarettes, all involving adolescents. And all of this comes a day after a Tomball High School student was hospitalized after using a vape pen after school. Let's go live now to ABC 13's Nick Dotario speaking with the health officials today. And Nick, what are they saying that is actually causing this? Clearly, it's a tobacco product. We already know that it's known to be deadly throughout the country. So what are they saying locally?
Well, unfortunately, that's the real scary thing about this, Art. They don't know exactly what has sparked this epidemic. What we do know is they're working with area hospitals to try and collect information to help the CDC determine what is going on. What we do know is it's put hundreds of people in the hospital across the country. One of those right in College Station, who's sharing his story with ABC 13 to hopefully keep others from falling ill. After 1.5 years of vaping, a Texas A&M student says he's finally had enough.
It's horrible for you, and I came very close to death, and I'm lucky.
Last week, he was rushed to the hospital after spending days in the ICU. Hunter Sims' family feared the worst.
They were very close to putting him on a ventilator, He was not breathing well on his own. At one point, one night, they put lots of ice packs on him to lower the temperature.
Sims isn't the only vaping case health officials are looking at. Brazos County Health Department says it's investigating 2 suspected vaping cases. In the city of Houston, it's confirmed 3 cases. In all, more than 450 across the country has led the CDC to call this a vaping epidemic.
There does not seem to be any antidote, any magic bullet to reverse this. It's supportive care, getting the patient through the critical period and letting their body heal itself.
Experts say this could be tied to THC being illegally added to vaping liquid or vitamin E. They say parents should look for signs of fatigue and cold-like symptoms. Experts say vaping is bruising lungs, something they've seen before with chemical leaks.
The difference is that when we have a chemical release, generally the neighbors and the people nearby who do have problems, they have it pretty quickly. This seems to take several days.
Health experts say around 20% of high school seniors have experimented with vaping, an experiment Sims wishes he never attempted.
It's almost every kid, and it's an epidemic. It just needs to stop. I think the FDA needs to really crack down before this gets worse.
E-cigarettes are regulated. The FDA does test the ingredients. And also in the state of Texas, the age to buy e-cigarettes just went up 10 days ago from 18 to 21. Live in Houston, Nick Notario, ABC 13 Eyewitness News.
The dangers of vaping continue to make headlines on a national level and right here at home. 3 Houston teens have recently suffered injuries so severe they were hospitalized. Channel 2's Brittany Jeffers live near the Texas Medical Center this evening with a story all parents need to hear. Brittany?
Well, officials say that all of these hospitalizations happened during the month of August, and all of them involved teenagers. And because of that, officials have a message for parents tonight.
This is a real phenomenon. Parents, you need to look out for your kids, find out what they're doing, educate them that this is dangerous.
A new and serious warning from the Houston Health Department. Within the last month, 3 teenagers had to be hospitalized with what's being called acute pulmonary injury by vaping. Local health authority for the Houston Health Department, Dr. David Purse, says the teens experienced a lung injury and displayed symptoms like shortness of breath, persistent coughing, and unexplained fatigue. Nationwide, the Centers for Disease Control and Prevention say there's been 450 possible lung-related illnesses associated with using e-cigarettes and 5 confirmed deaths. In Texas, the Department of State Health Services reports there's 17 confirmed or probable matches to the symptoms and substance use reported nationally. It is just the tip of the iceberg. It's going to continue to get worse and worse and worse. Samantha Boyd isn't surprised. In fact, the founder of StopVape.org says that for years she's been worried this would happen and has actively pushed for regulations and raised questions about the oils and flavors in vaping products. In Houston, health officials say the 3 teenagers should recover, but that number could change.
The cynic in me is concerned that it's going to increase, right? This is why we got to encourage the parents to get ahead of this.
So in Texas, it is against the law to sell tobacco products to anyone under the age of 21, and that does include vaping products. Reporting live, I'm Brittany Jeffers, KPRC, Channel 2 News.
We begin with that health alert as 5 people who are not old enough to buy e-cigarettes are currently being treated for illnesses related to vaping. The Houston Health Department giving details on 3 of the cases. They say those cases all happened within the past month. They had no one, they're pointing out no one should think that this is a safe alternative to smoking.
In fact, this new phenomenon only reinforces the fact that no one should be taking any sense of feeling secure that because I'm vaping, I'm not being exposed to the dangers of tobacco.
Across the country, we are now at 6 people who have had deaths related to vaping. Now, just last night, we told you about a Tomball teenager who collapsed after using a vape pen. Tonight, a young man in Dickinson is talking to us about his experience with vaping. He's speaking from the hospital. The A&M student has been under medical treatment since Saturday, and Fox 26's Maria Salazar joins us live with his warning. Hi, Maria.
Hi, Caitlin. That's right. I talked to Hunter Sims and his mother, Dawn, over the phone. Hunter was a baseball star at Dickinson High School. He's a very athletic, healthy young man who earlier this week was fighting just to take a single breath. Now, yesterday was his 20th birthday. He says the only thing he wishes is for people to put those e-cigarettes down.
even if they think it's cool or their friends are doing it, it's just not worth it because it can put you on your deathbed.
That's exactly where Hunter Sims thought he was on Saturday when he was admitted to the hospital because he felt he was suffocating. The culprit, vaping. He had a bacterial infection on top of
chemical pneumonia.
The 20-year-old from Dickinson is at St. Joseph Hospital in Bryan, Texas. He shared this post on Snapchat warning vaping is dangerous, saying CDC researchers were there with him and a woman in the next room, and that he may need to be put into a medically induced coma. Hunter's mother, Dawn, says she knew her son vaped, but had no idea it could be deadly.
We just didn't realize how toxic it was. We just thought it was legal. We didn't realize that this could be a deadly device. You just don't know. Pulmonologists warned us and said they have no idea what's in the vape.
On the phone, Hunter sounded winded. He's improving, but not in the clear yet.
I'm still really short of breath. It's hard to eat without having to take breaks, or I can't really stand without getting dizzy or walk to the bathroom.
Dawn says her son now calls all the selections of flavors a fantasy world.
Flavors, and it just pulls them in. It gravitates them, and they walk into these shops and think, ooh, I want to try this and that flavor. I think it's a priority to definitely have that talk with your kids and even young adults, and it could potentially save them from what we've gone through, because this has been a horrible, horrible ride.
Now, there are still many unknowns, but the hope is that Hunter will be released from the hospital on Friday. Let's hope that he'll recover and be able to play baseball again.